thanks in particular for organizing this event together with us and all the charity partners, artists. And I think it's great that we come together here. And my job is to introduce the first speaker, and it's absolute pleasure to introduce Jo Gray. I say a few words about myself first. I'm Wiebke Alt. I'm the director of the Institute of Metabolism and Systems Research, for short, IMSR, and I'm an endocrinologist, so a hormone doctor and hormone researcher. And I'm very much interested in conditions where patients produce either too much or not enough steroids. Yeah? And this includes patients with adrenal insufficiency, with congenital adrenal hyperplasia, many patients with adrenal tumors, and also patients with polycystic ovary syndrome. And Jo Gray and I go back quite a way, because we had a lot of interaction about our adrenal tumor work. And to say a few words about Jo. So Jo came to the charity work out of her patient experience, because she was diagnosed with a pheochromocytoma very dramatically in 2000 and had to undergo surgery for this. And then afterwards, it was discovered that the pheochromocytoma, the adrenal tumor, arose because of a genetic condition not only she was having, but also one of her sons and her mother. And that obviously then led to several other surgeries, because in these conditions also the thyroid can be affected, and she and her family underwent several procedures. But very importantly, that also led Jo to engage and champion the patient's voice in improving care and improving research into these conditions, multiple endocrine neoplasia, or MEN. And she has engaged as a representative for MEN2A with AMEND, with the charity she's now representing. She became a trustee, and in 2013, she became the first salaried CEO, Chief Executive Officer of the charity. And Jo is an extremely energetic person, and we had a lot of interactions because she was super instrumental also in creating the sister subgroup charity ACC Support UK for patients with adrenocortical carcinoma. And she has juggled all these responsibilities with bringing up her family, and her two sons are now like in their early 20s, but amazingly, Jo did also a few things I have never managed, which means to really do some exceptional stuff. So she trekked the Sahara, and she climbed several Yorkshire peaks, and she did a nighttime climb of peaks in the UK, all for charity. And this is totally amazing, in particular because obviously, as I know, both her adrenals now had to have been removed. So that means Jo has adrenal insufficiency, which always requires special adjustment of the steroid hormones for replacement. So all the more impressive. So Jo, over to you.
Thank you so much. That's yes, very, very generous introduction. Thank you, Wiebke. So as Wiebke mentioned, I am a patient, but also I'm the Chief Executive Officer of the Association for Multiple Endocrine Neoplasia Disorders, which is pretty tough to say after a couple of gin and tonics, which is why we shorten it to AMEND. And I'm just going to chat about our participation in medical research. So I'm just going to run through who we are, what we do, and also some of our more recent research involvement. And as already alluded to, the charity is called AMEND, which deals with multiple endocrine neoplasia syndromes. And sort of under our umbrella, we have two other groups for pheochromocytoma and paraganglioma tumor syndromes, and also for the very rare adrenocortical cancer. So I'm not going to spend time on the diseases, but safe to say that we deal with inherited and non-inherited conditions that involve the endocrine glands that make hormones, and the tumors that are involved in all these conditions can make higher amounts of hormones than is normal, and this can cause all sorts of symptoms, organ damage, and even death. And whilst some of them are benign, others are either cancer or can become cancer. So we do pretty much what you might expect a patient group to do. We provide patient information resources that are written in a way that the average person can understand. And we also provide these for children and young adults as well. We provide patient support, so lots of peer support, networking opportunities, but also a professional psychological counselling helpline. We raise awareness of the conditions that we cover, and also we encourage research into the diseases too. And to date, our research involvement has really started off with research funding, and probably about, I think it's £150,000 to date. And we can only do this when we have surplus funds, but generally speaking, each year there are several £10,000 or £15,000 grants to go to research into the conditions that we support. Most recently, we started even co-supervising master's projects at medical schools, which is a very interesting one for me, since I don't even have a degree myself, and I pretty much just squeaked by with my A-level biology. But I think it's really the breadth of experience that you can bring to these from working with so many patients with all these conditions over the years that hopefully has been helpful. We've also assisted in clinical trial recruitment and also recruitment to research databases in the past. And what I'm going to focus on now really is the lay representation on research projects that we get involved in. And so up to now, up until very recently, this was really one person, and that's me, representing all patient communities, working on all the projects that came to us. And the sort of number of projects that have come to us has ramped up over the years, and particularly the last couple of years after sort of government and NHS edicts to involve patients. So this is really a representation of me on a sort of Friday afternoon, trying to remember what on earth it is I'm supposed to be doing. So what we've started doing now is we're starting to get a little bit organized and spreading the workload slightly. And we're developing community advisory groups amongst our different disease groups that we cover. And we're hoping that these enthusiastic groups of patients will be helping to advise AMEND work itself, possibly, but more importantly, actually advising on research projects and clinical trials. And this will mean that I'll be much happier because I will know where I'm going on a Friday afternoon and the workload will be spread. Researchers will be much happier because they're getting the direct patient input. And patients who are involved as well will be much happier as well, because it really gives you a sense of purpose to be involved. So sort of things that we've done over the years include providing patient experiences, simplifying language in lay summaries, in documents for research projects and funding applications. We've also developed patient information leaflets for various projects, and it can be as simple as either developing or just completing a survey. Giving blood, urine or tissue is normally the preserve of the clinical setting, but I have to say that because of the tablets I take and my medical history, I have given a blood sample at a medical conference once to a very eager professor who was looking for people like me. So I'll come on to the adrenocortical cancer community, and in actual fact, it was getting involved in the most recent project with Professor Alt at Birmingham that instigated this this community group to be set up. Because what they've done is they've developed, the adrenal team there have developed a test which will hopefully help to identify much earlier those people whose adrenal lesions, which are detected for all different reasons, which ones are cancer and which ones are not cancer, and therefore the treatment pathways are very different. So you really need to find these people as soon as possible. And so I began getting involved in this project as the lay representative. And it quickly became apparent we really needed to hear from the ACC patients themselves. I'm not an ACC patient, and we really wanted to gather some evidence from this group, a very rare group of patients. And so that's what we did. We developed a wonderfully enthusiastic, very, very enthusiastic group of patients, lovely, lovely people who jumped at the chance to help. And in actual fact, what they've done so far is they've provided a lot of evidence about their diagnostic pathway. How did they get diagnosed? What were the obstacles in the way? And what were their priorities beyond treatment and cure? What were the priorities for diagnosis for these patients? And we did that through focus groups, and an upcoming patient survey will help to do this as well. And this will all feed into the further refinement and the project that is proposed and the funding application involved. And some of these people will then go on to help advise this project, subject to funding, for its 3-year journey. So and then actually most recently we were also then contacted by the Royal Marsden in London to say we want a community advisory group for medullary thyroid cancer, which we also deal with. And so we quickly managed to recruit some equally eager patients who wanted to get involved in this, and they have actually been advising the team there on another project, on another funding application for a clinical trial. And that again has been providing evidence, been really fascinating process as well. And that's even gone on to providing evidence at a technology appraisal for a new drug with NICE in the hope that we can get this approved for routine use in the NHS. And that was just last Thursday, and over the next couple of months we'll be helping with the same drug appraisal but for the Scottish Medicines Consortium. And so, as Vibeke said, we're actually quite familiar now with the adrenal research team in Birmingham, and this is the images here are actually us filming for one of our patient information films, and they very, very generously gave up some time to help with that as well, and we invaded them with cameras and everything else. So it was a great experience for us. But I wanted to just go over why patient involvement in research is so important. And I think it is always really worthwhile. The patients who get involved really gain a sense of usefulness and hope. You get to know what's going on in your disease a little bit better than perhaps you knew to begin with. And there's no better feeling than being able to help others and in the future, and possibly even yourself. And you can also gain a lot of confidence in talking with medical staff, because a lot of patients and people I do feel as though they're a little bit reticent, a little bit scared. But, you know, we find out through doing these things that actually doctors and scientists are also humans too. And in case you were ever in any doubt, this is a sign that it was on a door in the Birmingham Research Department, giving instructions to the professors on how to open the door. So we all have the same problem. So thank you very much for listening to me.
Many thanks, Jo. That's absolutely great. So, and I think I hand over now to the next introducer, which is Chris Mccabe.
Thank you, Vibeke, and thank you, everyone. It's a pleasure to be involved with this event. I'm going to introduce Lorraine in a second, but I guess I ought to introduce myself very, very briefly first. So I'm Professor Chris Mccabe, and I am the theme lead for endocrinology within the IMSR at the University of Birmingham. I have a research group, and we mainly research thyroid cancer, and we also research breast cancer, mainly looking at new therapeutic approaches in those two settings. Now, I'm a basic scientist, so I can't give any reliable clinical advice in any situation, but what I feel very passionately is that particularly basic scientists and translational clinicians need to reach out to patient groups much more thoroughly than we have done in the past, because it's amazing what you learn and that you don't know that you should know from being in these sort of fora. And so it's an education for someone like myself to be involved in an event like this, as well as myself hopefully imparting something useful. So that's enough about me. It's real pleasure to introduce Lorraine Williams to you. Lorraine is the director of the Thyroid Trust and has been for around 4 years now. The Thyroid Trust works with trustees, volunteer teams and supporters to launch, this new charity, and is working hard to raise awareness and improve understanding of thyroid health issues, which are very broad and frequent issues. The Thyroid Trust advocates for patients, encourages broad expression of patient experiences, which is that sort of missing link that we need to have between the science, the medicine and the patient experience, and runs regular support and information events and produces some great videos with great speakers, and also facilitates peer support. So Lorraine Williams, I'm going to hand over to you now, and Lorraine will discuss some of the charity's work and highlight why the patient voice is important. Lorraine.
Thank you, Chris. Can everybody see my screen? Excellent, great. So yeah, we just completed registration of the Thyroid Trust, in fact, in 2019, but yeah, we started working on it in 2017, and I've been involved in patient advocacy and peer support networks going back to 2010, having been diagnosed with hypothyroidism at that time, and having a really difficult and unpleasant time with it, which motivated me to want to do things for other patients, make things better for others. Here we are clicking forward. So yeah, I think everybody who's involved with the Thyroid Trust, that's really what drives us. It's unfortunately the case that although thyroid disease is very common and is usually quite easy to treat, I think generally it's recognised that maybe around 10% of patients don't necessarily have such an easy ride with it, and so it's really those sort of patients who are struggling that we're really there to represent, because we know that there are some excellent treatments available for the majority of patients, and it's an area which is perhaps been slightly under-researched, and maybe partly that could be because while thyroid disease is common and it can happen to anybody, it tends to happen more to older women, and there's a recognition, I guess, that diseases that affect more women than men have perhaps traditionally tended to have less research resource put behind them. So we're kind of coming into a situation where we think there really needs to be a change. We want thyroid disease to be more high profile, taken more seriously and better understood. And we recognise that we have a really big challenge because it is a common condition, but we're really ambitious to make a big impact. I mean, I used to work, in fact, when I became ill, I was working for Cancer Research UK, and I keep saying sorry, I'm a bit nervous. Once upon a time, cancer was a taboo word, and it wasn't really talked about very much. And I worked on the Pink Ribbon campaign for breast cancer awareness, and now everybody knows that the Pink Ribbon stands for breast cancer, and people take that illness, of course, very seriously. It can be fatal, and it's a dreadful, dreadful condition. But we really want people to know what their thyroid is before they're diagnosed, so that when they get a diagnosis of thyroid disease, they go, oh, what does that mean? So we talk a lot about the butterfly-shaped gland, and we do sort of fundraising and awareness activities using the butterflies as a bit of a theme. And we don't think there's any reason why thyroid disease can't be something that is more part of sort of public discourse and better understood. We did a survey recently where we asked people just on Twitter, when you were diagnosed with your thyroid condition, did you know anything about it? And the vast majority of them knew literally nothing. So that's a big challenge. So we work very hard to share reliable evidence-based information. We're a patient-led organisation, but we work very closely and collaboratively with the medical profession. We've got a couple of fantastic medics on our trustee board, and as Chris mentioned, we do regular talks. They're all online at the moment, but they used to be mostly in London, and we have an ambition to have more groups taking place around the country, doing more events, but we have a great relationship with lots of clinicians who've come and spoken at our events, and we're constantly widening and broadening our network and connecting with more and more clinicians and researchers and different organizations. Obviously, peer support is very, very important. We'd like to do more of that. One of the reasons that we want to raise awareness is because we know that the more thyroid diseases is recognized and generally appreciated to be a serious condition that can and does blight people's lives, then that is likely to lead to more resources for research being made available. And, you know, as well as the the work that we do, we've got quite a nice website, we've got a lot of resources on there, we try and sort of make that very accessible for people. We're very, very active on social media, particularly on Twitter, so we connect with all kinds of people that way. We've done a lot of work getting stories about thyroid disease into all different types of media, both local, regional and national, broadcast and press. And we're quite good at telling stories and making it interesting. And I think because it's our personal experience, that's something that we bring to the party, so we can make the topic of biomedical research and the need for it perhaps just more appealing and more engaging, and therefore likely to attract more support. In terms of our patient advocacy work, it's all part of the same thing, really. We want to raise the profile of thyroid disease. So one of the things that we did very, very early on, before we were registered as a charity, but we were just sort of starting to get set up, was we got wind of the fact that there was going to be a debate in the UK Parliament about access to a specialist treatment for hypothyroidism. And we put a lot of time and effort into writing a really detailed briefing for parliamentarians about why that was important. And as a result, we were really happy that the debate very much involved parliamentarians standing up and saying the things that we had said in our briefing paper. So I think when you're a professional or you're working in a particular specialist field, there can be almost an assumption that when you're trying to sort of get your point across, you maybe don't need to say very much. Everybody's busy, and you think sort of a couple of lines will do. But actually sort of investing the time and energy in producing quite sort of detailed explanatory papers and making them very clear and easy to understand has developed some good results. And also on the subject of patient advocacy, when the new NICE guidelines were developed, we spent hours and hours and hours poring over the draft guideline and giving our feedback and saying why we thought certain things were really important to be included in that. And we were really pleased that quite a lot of our suggestions were taken on board. We had quite a lot of influence on that. So it's that personal passion, I think, and that ability to communicate the need, which is effective. And obviously we want to influence researchers. We want researchers to be addressing the issues that are of most importance to patients. Likewise, policymakers, we want them to be taking thyroid patients' needs seriously. Healthcare providers, when they're allocating resources and time and energies, we want them to be aware of why thyroid patients are banging on about the things that they are. And also patients, we want patients to feel less alone and to have confidence in the healthcare system, and also to feel that they've got the information that they need and that they are empowered to talk about and influence their own care. So one of the things which is really, really important in all of that is being a calm, sensible, effective voice, and so that's where we come from, really. We created this little brand with the coloured dots around the edges with the Thyroid Trust written in a very traditional font, and what we're saying with that is we are very sensible and we are very inclusive. Our little coloured dots are a diverse and inclusive support circle. And the butterfly, likewise, talking about the butterfly gland is a very simple message to get across to people. We've developed a registry of patient experiences, and this is again one of the first things that we started to do. Was you go into patient forums and you'll have there's lots of online forums that exist now. We don't run one because it would be really difficult to manage, but we're sort of aware of a lot of them. And you'll see people saying, why don't researchers just come onto this Facebook group and then they'd see why such and such a thing is such a big deal? You think, well, researchers are not going to do that. And obviously you've got a self-selecting group there. It's not scientific evidence. So we now have a survey form on our website where people can complete a series of questions to basically share their experience in a form which is timeless and anonymized and captures rich data about their diagnosis pathway, the issues they've experienced, changes in their treatment over time, the things that are most important to them. And we did that actually without a lot of input from any professionals. It was just something that we thought was really important early on when we were working on the follow-ups to the debate in the House of Lords. But it's given us a really rich data source now, which our next plan is to find a research institute who would be interested in working with us to codify that registry. And perhaps there's another version of the registry that could be developed, which is more refined. But we hope that there are some really useful insights there that could be made use of. And then just in terms of supporting research which is already underway and which we haven't been involved in initiating, obviously we use our website and our various communication channels to disseminate surveys on behalf of professional researchers, and we conduct our own surveys as well. So, you know, we can do a survey on Twitter and get 200 responses over the weekend, just asking key questions and getting people to feedback on things such as, you know, what did you know about your thyroid condition before you were diagnosed? And typically the answer is nothing. What are the symptoms which concern you most about your thyroid disease? And the number one response that came back to that was fatigue, closely followed by that ever mentioned brain fog, which researchers don't necessarily feel that they understand sometimes, but patients can talk about very passionately. We are obviously always very happy to help recruit research participants, and we're very happy to talk to researchers really at any stage in a research project, because we want to represent the patient perspectives and highlight the issues that are of most importance to patients, and try and do that in a very calm, even-handed, helpful sort of a fashion. You know, we've recently helped recruit participants for a major global survey led with a number of leading clinicians, including Professor Petros Peros in the UK, where they wanted to understand experiences of patients with hypothyroidism. And they got more responses from the UK than I think they did from any other countries. And I think we might have been at least slightly influential in that. But we would have liked to have been involved earlier on in actually helping to shape the questions more, because I think there were maybe some tricks missed in the way that some of the questions were framed. And we got a lot of feedback from patients that they weren't delighted with the questionnaire itself. So I think that's something to think about, is actually involve patients at an early stage. We're talking to a number of researchers about projects which are in the pipeline. And we had some really interesting focus group sessions with a group of researchers at the moment who are considering a new piece of work. And they had focus groups with ourselves and some of our partners, so leaders of thyroid patient organisations, and they had separate focus groups with randomly selected patients. And I think both of those conversations were hugely valuable. I know they've made changes to the plans based on the comments that we made. But they also specifically said that they were really kind of surprised by the quality of the input that they got from the so-called expert patients. I think sometimes when researchers are looking for patient input, they shy away a little bit from talking to the patients who are maybe most vociferous or most engaged with their condition, because they think they'll get a skewed viewpoint. And obviously that's true. Patients come in all sorts of different flavors, and we're far from being all the same. But I think when you have got patients who are very, very engaged and involved and invested a lot of time and energy in informing themselves about their conditions, you can get some really, really valuable insights, certainly the case. And, we're not afraid to be a little bit challenging. I'm talking to another researcher recently who's planning a different project, which we were really excited about, thought sounded really interesting, but we really didn't like the way in their case for support they described the patient issues. And we pushed back quite hard on that when they asked us, will you support this research project, because it would be good to have a patient organisation endorsement. And when we said, yeah, we definitely support what you want to do, but we don't like how you've talked about patients, their initial feedback was, well, I just want your support. I wasn't really looking for any input. And then they came back a little bit later and said, oh, actually, yeah, well, that wording actually is quite helpful. And what we were trying to do was not just be challenging and be bolshy, but we're trying to add value, because I think when you have patients describing why things are important and why the impact is going to be so significant on their lives, it just carries a lot more weight than a very sort of glib academic sort of statement, or a lot of clinicians are probably not intentionally, but can come across as being quite dismissive of patient issues, and so they sort of just describe them in very, very shorthand ways. So I think we can add a lot of value by doing that, and we will continue to challenge and push and try and really sort of get that across. I think helping frame the case for support is critical. If you don't get that impact on people's lives really, really clearly articulated in plain language, then you're less likely to get the funding that we want you to get and to conduct the really, really important studies that need to take place. So we would like to be talking to more researchers at the planning stages, or even pre-planning, and have a look at our patient registry and see what research themes perhaps that might prompt, or how that might feed into things that researchers are thinking about already. We fed back to the researchers that we were talking to, who'd had the 2 different focus groups. We said, oh, this is so exciting, this is co-creation. And they said, no, it's not real co-creation, because we've done loads of work before we brought you into the room. So next time, maybe think about that, because you can then maybe end up, through actually collaborating with patient groups, with something that's much, much more innovative. And I think that's going to be more interesting for funders, and more likely to yield some really genuinely meaningful, worthwhile results. Through our general sort of networking, came to an event that the Institute organised on the interface between art and science quite recently, where I met the amazing artist Vicky Roden, who's going to be speaking next about the fantastic work that she's been doing with colleagues here. And I just think that is so innovative, and that is so exciting, and Vicky's going to tell you all about it. But I'm really excited that where we're at now in our journey, as I said, very, very new, very tiny little patient charity with some really big ambitions. We're starting to talk to IMSR, and hoping that there will be opportunities for us to do things together in the future, because we are all human beings and we can all learn from each other, and that's that's a beautiful thing. So I'll just finish by saying this is our website. On the information section, research pages, if you've got any research projects that you're looking for patients to get involved with, we can showcase them here if they're relevant. And obviously, if you are a patient looking to get involved with research, have a look at that as well. And we're always looking for new content ideas. So please get involved, and thank you very much for the opportunity to speak today.
Wonderful. Thank you, Lorraine, so much for very eloquently describing, I think, particularly that relationship between a group such as yourself and the researcher such as myself, or Vibke or Punith, where it's a very interesting point you're making about, if you're looking at people's scientific proposals of the research they want to do and framing the question through the eyes of the patient. Because that, in cold, cynical terms, even that's quite an emotive thing for a grant funding panel to see. Yes. That this has come through the eyes of the patient, that this is critical to the patient.
Exactly.
And I think sometimes as scientists and clinical scientists, we're guilty of following something really interesting scientifically, and maybe not, framing the question more broadly in terms of impact. But of course, research funding, particularly in the UK, is drifting in that direction at the moment. And so I think what you're highlighting, and I think this reflects everything that we're talking about today, is so important at all angles, from all angles. So you did a nice job as well of starting to introduce Vicky, which is terrific. So it's my job to introduce Vicky Roden, and of course, Lorraine, as you were saying, yourself and Vicky met at where art meets science kind of event in the systems, the Centre for Systems Modelling and Quantitative Biomedicine within our Institute for Metabolism and Systems Research, which Vibke heads, of course. So, Vicky, I'm just going to very briefly introduce you as a multidisciplinary artist. Your work encompasses a large variety of media, including textiles, embroidery, and even taxidermy, as well as live art. Vicky, you are a former hypothyroid patient, and you have, through that, engaged, as I said, through the SMQB in new artworks to creatively explore the condition. So Vicky's going to tell us about some of the background to her work and the thinking behind these pieces, and share some creative arts based approaches and say how they can be powerful. as I guess very visual and central ways to engage others in health conditions, and how we discuss those and understand those, and how that relates to I guess the interface between the science, the clinician, and the general public. So Vicky, without any further ado, I'll hand over to you.
Thank you. So yeah, I was really lucky in that I got involved with the SNQB incubator project, where they teamed an artist with a research group that were looking at a particular medical problem. One of the projects was precision antithyroid therapy, and as has already been said, I'm a previous hyper, so overactive thyroid patient. And now I'm very much underactive because I had 2 rounds of radioiodine therapy to get my thyroid under control. And it was an absolutely amazing experience because it very much gave me the opportunity to kind of give something back, but also really brought home to me the fact that a lot of the things I experienced as an overactive thyroid patient that I assumed were down to my own levels of depression or anxiety or just generally being a bit odd or so on and so forth, were actually very much rooted in my thyroid condition. So it was very interesting to me to actually be in a situation where I could sit down with researchers and I could have those conversations with endocrinologists that when you're a patient and you're going to see your specialist, they've got no time, you're anxious and don't necessarily know how best to frame your questions. All they want to do is get you better as quickly as possible. So they're looking at all of the potential options and they're trying all of these things, and you don't even necessarily know the right questions to ask. That is never a good situation for a decent conversation about a condition. And it's no blame on the patient and it's no blame on the specialist. Everybody is in such an absolutely beleaguered position at that point. So being part of this team and actually being able to have those discussions where you can chat for an hour and then a random thing pops up in your head and you can bring it up, and it makes things make so much more sense. That was absolutely amazing. So yes, I'm just going to screen share. So I did the incubator project. I will just start the slideshow. And I was very much, basically it was very much looking at ways of improving antithyroid therapy. So it was more responsive to the patient's needs. So I was very much talking about things like tremor and anxiety and sleeplessness and fast heart rates and so on as indicators as to how well the medication was actually working. And as far as the art went, I very much took it right back to the word thyroid, because the thyroid is actually named for a Greek shield. Basically, Brad Pitt in Troy, his shield. So because it has that sort of the butterfly shape, that was how it was originally named. So I ended up doing a bunch of experimental works around that shape, because something that I find very important is I very much felt disempowered by my illness. So this is very much a means of me finding that empowerment again. So the idea of this as a shield was quite intriguing to me. So I did a lot of experiments around the shape and also around the medication I was taking at the time. Then I started working on some embroidery, because with all of the Greek mythology elements and how traditionally a lot of chronic conditions were very much understood in respect of being a god's curse, the way that, for example, I think epilepsy was known as the curse of Apollo. So I basically very much felt like the overactive thyroid condition and that constant sense of your fight or flight response being turned up to maximum and then left there, it very much felt like the curse of Athena, the whole idea of being primed for a battle that was never going to happen. So that was again another exploration of the shield. I also had a look at traditional remedies, which there are none. The closest is common Gromwell, which can be used to bring down goiter. The other major one is wearing the amulet made of the skin of a hanged man about the throat, which I don't think is going to be too popular. So I did a whole project where I actually grew common Gromwell from seed and used it as a game board, part of a game board, which I will show you in a moment. But what I mentioned earlier about understanding a lot of the things I was going through in relation to my actual thyroid condition. Basically, this is a photo of me circa 2002, I'd say, when I was very, very overactive. Even the act of blowing that bubble was really difficult because I was constantly shaking. And I blame myself for a lot of decisions I made at that time, but now I actually kind of realize I couldn't have existed in any other way. That's actually, I turned that into a film piece that is on YouTube. And these are all figures. So I did a cast of a little figure. Some of them had these wonderful sort of structures around the neck that were quite amazing. And they were actually the game pieces for the eventual board game that I made. That's the final game board. So basically the idea was to kind of have a metaphor in the form of a board game for the difficulties of thyroid treatment, because it is so, there is so much luck and also judgments. It's like a combination of chess and chance. So this was basically a board game that combined dice throws with choosing how many, at what particular dice to actually throw and so on, to try and have the metaphor of, even if you absolutely put your best game in, you may actually never actually resolve the condition. There's a lot that can be done, but it's very much that it is such a tricky condition to treat on that basis, because everybody responds differently to treatment. Sometimes you can be taking the carbimazole or something and then you'll just stop, you'll become almost immune to it. That's what happened to me. Some of the medications can absolutely KO your white blood cell count, and then you end up in a situation where you are looking at, right, surgery or radiation therapy, and it is a very, very difficult process. So that's the actual game board with the pieces on. Yeah, so through this I have like I said, I've become involved with the Thyroid Foundation. Sorry, Thyroid Trust. I'm terribly sorry. I'm a little tired. So I've been involved with the Thyroid Trust, and so it's been really nice actually kind of working with them to actually sort of encourage just the discourse about it, because I do feel like the condition isn't really discussed enough, just on the basis of it's a lot less scary when you know what to expect. But if you don't know what to expect, you basically assume that it is something that is fundamentally wrong with you. So yeah, actually these realizations have been quite amazing and important for me. So yeah, that's basically a wonderful means of kind of patient advocacy, helping to decide where research goes. And that's basically me.
Thank you, Vicky. I think we're going to Punith now. He's going to introduce Christine.
Thank you, Caroline. It's been lovely listening to people of various patient support groups. I've actually worked with most of them already, although I'm quite early in my career. Lorraine, Benji, first saw our comics, so we've had some experience already. Okay, let me start by introducing myself. My name is Punit. I am a Wellcome Trust Clinical Research Fellow at the Institute of Metabolism and Systems Research at the University of Birmingham. My academic interests are looking at polycystic ovary syndrome and its impact on metabolism and emotional well-being. And today it's my pleasure to introduce Christine. Christine got in touch with me when we did our first iceberg photo of PCOS, showing how much of hidden aspects are there for PCOS. So to start off with, so Verity is a self-help group of women with the polycystic ovary syndrome. They were established in 1997 to share about the condition and how people with PCOS can improve their daily living. It's basically run by a dedicated board of volunteer trustees, and Christine Stuck is one of the trustees there. Christine has been a trustee at Verity since 2014, and prior to that she was the London local group leader since 2012. Outside of Verity, Christine works in broadcast media and enjoys crafting activities and is an avid reader. We'd now pass on to Christine to hear her experience as a person with PCOS and also her experience in leading Verity.
Thank you very much, Punit. Bear with me 1 second whilst I do the screen share. Brilliant, perfect. So yes, as Punit mentioned, Verity has been running since 1997 and has been run by volunteers pretty much that whole time. We're actually one of the oldest PCOS patient organisations in the world, which is a big thing to be a part of. I was diagnosed with PCOS myself on New Year's Eve 2009, and I was at university. And actually, my own experience led me to find Verity because I was very much left with, okay, you've got this thing, it might cause you some trouble having kids later on, just keep your weight down and come back to us when you want children. And that was pretty much it at the time. So that's how I got involved with Verity, just to find out more about the condition myself, and then obviously got involved volunteering from there. So for those of you who don't know much about PCOS, PCOS stands for polycystic ovary syndrome, but actually it's a pretty badly named condition in that side. So you don't actually have to have cysts to be diagnosed with PCOS. So the name of the condition is really misleading, and polycystic ovaries are actually one possible symptom of the condition. And about 1 in 5 women of reproductive age in the UK experience polycystic ovaries, but don't necessarily have the full-blown syndrome. So it can be really confusing. This has also led to a massive focus on the fertility aspect of the condition, which is, again, just one aspect of the overall condition. PCOS, as we know, is actually classed as an endocrine or hormone disorder. Symptoms can include irregular periods or lack of periods, but you could also have regular periods but not actually be ovulating underneath it. And if you're having regular periods but you're not ovulating, that can lead to difficulty becoming pregnant, hence the focus on fertility aspects. But outside of that, you can have this hormone imbalance can actually cause things like unwanted facial or body hair, so hirsutism, which has been considered traditionally male pattern, which, you know, with societal expectations of women having to be hairless, can cause a lot of emotional distress as well. You can experience oily skin and acne well into your sort of 20s, 30s, 40s. You can also experience thinning hair from your scalp. You can have difficulties managing your weight as part of that hormone imbalance. So you could gain weight rapidly, you could find it difficult to lose weight, you could find it difficult to maintain a stable weight as well. But again, that's one possible symptom. We have a lot of patients who are of a normal or underweight as well, but still have the other symptoms. And you can have depression and mood changes. If the condition is left undiagnosed and unmanaged, it actually increases your likelihood of developing things like type 2 diabetes, cardiovascular complications, and even endometrial cancer later down the line. So approximately 1 in 10 women in the UK have polycystic ovary syndrome. It's estimated anywhere between 8 and 13% of reproductive aged women across the world. So that's where reproductive age comes in. A lot of the research into PCOS focuses on women of reproductive age. So we don't know very much of those before or after that. So we do know that you can still be affected by PCOS if you're post-menopause. You can also be affected by PCOS if you are someone who menstruates but doesn't identify as a woman. And these sort of groups of people are very much left out of the research that we do have for PCOS. So it's important that we start expanding that and really look at the lifelong impact of the condition. Currently, to be diagnosed, there's a mixture of different tests that can be done. So a scan where they check for polycystic or enlarged ovaries. This can change depending on where you are in your cycle and at different life stages. So they may be present, they may not. Irregular periods or a lack of ovulation. So that's very much through tracking your own cycles. So that could be periods that happen too regularly. They could be periods that don't happen regularly enough. Or they could just not be there at all. Or as I said, you could be having regular bleeds, but not actually ovulating, which is much harder to identify. And then excess androgens, so that's done via blood tests. And again, your hormone levels change throughout your cycle, throughout your life. So a blood test might come up within normal ranges, but actually at the high level. And if you did that blood test again 2 weeks later, it could be completely different. So it can make it really difficult to get a diagnosis. Once people are diagnosed, what happens next? Well, as I said, in my experience, unfortunately, it was very much there isn't really much we can do for you right now. I'd actually been put on the pill as a teenager to try and regulate irregular cycles before I'd got diagnosed, and had to come off it because it pushed my blood pressure up and it was dangerous for me to take it at that point. So I didn't even have the pill to fall back on as a management technique at that point. So it was very much go away, keep your weight down, and come back when you want kids. And that is still quite common today. So historically, patients have been given this high level non-specific guidance, and it doesn't follow that HAES approach, so health at every size. So that lack of specific guidance leads to increased levels of low self-esteem and body image, increased levels of anxiety and depression, and we have an increased prevalence of eating disorders and disorders eating within the community as well. And that lack of a HAES approach can be really off-putting to patients and can actually lead to a lack of active engagement with medical professionals, as we feel that we're not being listened to. This in turn can lead to less regular check-ins and monitoring of the condition, which increases that risk of developing those secondary long-term conditions. If you then take into account that 70% of people with the condition don't even know they have it, you know, it's really difficult to manage something that you don't know that you have. So regular checks such as hormone panels, blood sugar checks, blood pressure checks can actually be really helpful and early intervention points for helping you manage your condition more effectively. So why do patient advocates matter? So as mentioned, Verity is very much a patient advocate group. We were set up by patients for patients, and Verity was chosen as it means to share the truth in French. So that is completely our approach. So as part of our role, we want to promote patient voices and the freedom of choice over their care, that they don't just have to take the pill, or they don't just have to take, you know, different routes to manage their condition. To disseminate medically accurate information as well. So as a condition where a lot of emphasis is put on weight loss and a lot of emphasis is put on fertility management, we are quite easy prey for products that don't necessarily have medical backing behind them or research behind them in order to promote weight loss and fertility, and not necessarily always in healthy or safe manners. So it's really important that people have medically accurate information to guide them in their management of the condition. And we also help others navigate the healthcare system and make informed decisions. We very much appreciate that GPs and healthcare professionals usually get about 10 minutes with us. And in the overall training of a healthcare professional, they don't get very much time on specific conditions like PCOS in their training. So unless they choose to focus on that area and do extra research, they will only know the high level information about our condition. And that's why patient advocates really matter in getting the right information, in teaching other patients about resources that will be helpful in helping frame and guide those conversations with their healthcare professionals as well. But most importantly, research really matters, and PCOS is a massively under-researched condition. You know, I think in a previous DAISY webinar in March this year, there was something like 20,000 published research studies on PCOS, which is not very much. And as I said, the majority of those have had a tendency to focus on things like fertility and weight management, and really don't look at that long-term impact that the condition can have. So at Verity, we encourage active patient participation. We provide feedback and direction for people getting in touch with their research proposals. So we will always do a quick review of any research before we push it out to the community, and give feedback on the way questions are framed or what they're trying to get from their research. And hopefully this will improve future diagnosis and care. And as we mentioned earlier, because patients don't feel like they're being listened to, they don't always tend to engage, but actually we're working actively with the DAISY PCOS team and their leadership team to make more people confident in coming forward and advocating for the condition, and advocating for more research and evidence that we need to be able to manage the condition and get better treatment for future generations, hopefully within our generation, but definitely for future generations. And then as well, Verity, as we said, is completely volunteer run. We have a network of local groups that are primarily online at the moment, but hopefully back in person soon. We have medically verified booklets on PCOS. We used to run conferences during normal times, and hopefully we'll be getting back to that soon. And you can find out more about us on our website or through our social media channels on @VerityPCOS.
Thanks, Christine. It was a lovely overview of the amount of work you do. I'd like to end this, I'll hand over back to Caroline in a moment, but one statement that you made is like a resonating one every single time I see a person with PCOS. They say two things. One, it took me to move heaven and earth to get diagnosed with PCOS because no one believes me. And when I do get diagnosed, they say, oh, this is nothing, just go do diet or exercise and come back when you want to get pregnant. That's a very common thing. And this is what we want to change. We want to change that perspective of how patients are seen. We want to get you involved. And at the end of the day, I'm a strong believer of end user feedback. It doesn't matter what we want to do. It's all about what you want. So we want to listen to you. And with that, I'll hand it over back to Caroline.
Yes, thank you so much, Christine, and to all our speakers. I'm just conscious of time because we're meant to be finishing now, but I think obviously we'll throw the floor open to questions. So if you do have a question, please do put it into the chat or Q&A. There's one that's just cropped up, so I'll begin with that, and we'll try to get through as many questions as we can quite quickly, just because obviously we've committed everybody to an hour, and I don't want to take too much extra time off from all of our speakers who've already been so kind in giving up their Saturday mornings for us. So there's a question in the chat. Are there opportunities for patients to help with teaching medical students about endocrine conditions from a patient's point of view? Anybody want to take that? Punith, Punith and Vibka have both got your hands up. Vibka, should we come to you first and then Punith?
I unmute myself. Yeah, I like this suggestion very much, you know, like sort of, and I trained in medicine in Germany, and there actually patients are regularly invited to attend the lectures and the small group teaching to tell the students directly about their experience, which I think is a great tradition. This is sometimes organizationally difficult to do, but I think we definitely can introduce records of patient stories into the lectures, yeah, and that would be really important for students. Obviously, they talk to patients, but it would be good to give them access to the stories of the patients and their perspective from the start, so that they see it really from that perspective with regard to the things they do.
Punith, before we come to you, Joe's got her hand up, so maybe if we just go to Joe first and then we'll come to you, Joe.
Yeah, I was just going to say that there definitely are opportunities. We do a number of things in that in one medical school there is a whole program for having patients in to talk about their disease and to be questioned, and it helps the medical students as well, their second years, to begin questioning patients as well. And so we've been taking part in that for probably 10 years now. And the other one that we do is I do go and give a lecture to the to the master's students each year at another medical school as well. And I think, you know, all of these things go down really well, because a lot of them, depending on their point in their medical training, some of them are actually quite excited because they've not been able to meet patients yet. So to actually have that interaction at a very early stage just does seem to be very beneficial, and it would be lovely if that was rolled out a lot wider.
Thanks. Whoever asked that question, thank you very much. I think what Vipka mentioned that's happening in Germany, or happened in Germany, I don't know if it's still happening, we are making it a reality. We are actually working with Christine now. We've just about put together the first of its kind. I mean, when I look at the way a disease is seen, there's three groups of people. There's medical students who want to understand the condition. There's patients and carers who are experiencing it, want to know better about it. And there's doctors who want to solve it. And normally these three groups are trying to do the same thing, understand the condition, conquer it, but they're doing it separately. I have no idea why it's been like this. And for the first time, at least to the best of my knowledge, we are bringing all three groups of people with the first focus of PCOS, because that's where I study my research on, and putting together a program where we are having simulation-based learning and real-time learning for doctors and patients and medical students together on the 18th of September. We will be announcing it next week formally, but we are very excited about this because we've tried this model with just the doctors and medical students till now. It's worked out brilliantly, called Simba, but we want to take this one step further, get patients involved. The idea here is not just to listen to patients, but also to empower them and engage them so that they understand what is the latest research that's happening. And so they can then cause a ripple effect when they can go and talk to their peers or other people who have the condition and then share their information. So the information they are getting is actually accurate, more latest, and based on scientific evidence. And once we are very hopeful that this will be a successful event. And if that happens, it's a generic model. We'll be able to roll it on to Thyroid or ACC or anything in the future.
Thanks, Punith. There's another question that's come through from Esther, who had a benign adrenal mass, and her mother's also had issues with thyroid, and she advocates on behalf of her mother. And she's got a question around, do different variety of endocrine disciplines or science disciplines in general, I suppose, talk to each other? How well linked are, you know, endocrinology, dermatology, you know, fertility, all of that? Do they talk to each other enough? Particularly within the context of, you know, PCOS, for example, but obviously applying that to all the conditions that we've spoken about today. Anybody want to take that one?
I can start off because Vipka, I thought Vipka would answer this, because Vipka has been very instrumental at bringing this group together in Birmingham, at least. We have set up something called as a reproductive endocrine MDT, where we have endocrinologists, gynecologists, obstetricians, histopathologists, radiologists, and various other groups who have got together. And Christine mentioned about our DAISY PCOS study, which is, although it's a research-based study funded by the Wellcome Trust, it's also it's an integral part of the NHS clinics, where any person who has PCOS or suspected PCOS can come and get a detailed assessment, not just spend a 10 minutes consultation, but a 3-hour assessment. Also have, in the colloquial terms, almost like a stress test to see how much of glucose can the body handle. And at the end of it, they get an outcome saying, okay, if there's a concern with hair, we'll be able to refer you to a dermatologist. If there's a concern with weight, we'll be able to refer to your weight management specialist. If there's a concern with fertility, so on and so forth. This is happening. It's taken a bit of time, but it's happening, and we are already seeing that this is also being replicated in other centers. And I'm sure I mean, we can probably describe more on ACC, because that was first done in ACC, because I've been doing it for the last 20 years or so.
I mean, it's generally an approach, thanks, Poon, is that we take like sort of the, or, you know, like doctors take with nurses and everybody involved, which we call the multidisciplinary team. Yeah, so that we don't do things in isolation, but that we ask everybody who is involved with different aspects to come together to discuss. Yeah, and I think it has been published widely that if you have a multidisciplinary team, the care you provide for the patient is better, yeah, and helps the patients more, because otherwise the patient is the only one linking all these different aspects, and that is very stressful, yeah, and is sometimes not easy to communicate, yeah. So it's better to have a multidisciplinary team where everybody comes together and thinks together, because that also educates you on different aspects you might otherwise not be so familiar with.
Thank you, Vibke. Just I think another question to sort of perhaps round things off, just in the interest of time. Where do you see things going next in terms of patient involvement or public engagement with what you're doing? So perhaps I could come to the charities first, and then we'll go to the researchers. Anybody want to take that one first? Oh, Christine, go ahead.
Yeah, I'm happy to go first. Yeah, so with Verity, we're very small, so we haven't been able to fund research, which is something we would love to do in the future if we ever get the funds to do that. But we do actively engage with different research groups. We're actually helping 2 different researchers with their grant applications at the moment, and giving some patient feedback. And helping them put together patient panels for that at the moment. And also we've been able to be involved at an international level. So Pcos actually has international guidelines, and we were able to give patient feedback at that level as well, and raise patient voices, especially as the name of the condition has been proposed to change on multiple occasions. And actually sometimes what the researchers want, because it gets them more funding, isn't great for the patients, because it actually emphasizes misconceptions about the condition. So maybe a better name for the condition, definitely more active research, and keeping involved at that international level with other patient communities worldwide to, you know, really sort of even out the care that everyone gets everywhere, and improve that understanding, because, you know, we've seen it with all of the COVID vaccine research. When everyone pulls together and does something together, you get much better, faster results. So yeah.
Absolutely, and I know that Vibke's got a name that she's got in mind that she would love to get PCOS changed to. So there's certainly some candidate names out there to try to get a name which is more fitting with actually what the condition is actually really about. Vibke, do you want to say a few words?
Yeah, you know, like sort of, I totally agree with this. Like sort of, we sort of have a lot of thoughts about this, because the patients say this is, both patients and doctors in a way say it's the wrong name. Yeah, like sort of, I had 2 patients who sadly saw me after some private doctor removed their ovaries, telling them that they would then be healed from polycystic ovary syndrome, which obviously was completely wrong and rubbish, yeah, because obviously polycystic ovary syndrome is a systemic metabolic disorder, and the ovaries are just one of the systems and tissues reacting to the disorder. Yeah, so it doesn't help at all to remove the ovaries. And yeah, we are very keen to work with patients to sort of develop a name that all really can think that this represents what they understand from the condition. Yeah, and as you know, we have also the DAISY PCOS leadership group, which Caroline leads a year-long program to develop 30 women who have PCOS to leaders and champions for the cause. And one special thing which is very important to take into account is we have also a lot of women who are of South Asian or also Afro-Caribbean background, because And there are indications that PCOS is more prevalent in women from ethnic minorities. And often also there are cultural things where it's even more important that fertility is not at the outset of the name of the condition, to help women to embrace things and accept things, yeah, and to be in touch with healthcare professionals, because we also know that some women do not access healthcare out of fear to be labeled, and that's in a way the worst. Yeah.
Thank you, Vibeke. Chris?
I mean, Caroline, if I could maybe come in and sort of round off a few things there. I mean, I think the question was really how we move forward with patient engagement and that bridging that gap between charities, the research funders, and the people who actually do the research. And I think it's important to know that it is complicated, and there isn't one size fits all on this at all, because there are different levels of research, and very fundamental basic research on how cells work, for example, may not be informed directly by how we want to change patient treatment. It may be one step towards that, but it's a difficult sell for some funders to be convinced that there is a direct patient benefit for some research, because obviously we have to do the really fundamental stuff before we then get towards the patient. So it is complicated, but I think UK funding is heading in that direction, and I think we can only benefit from better understanding, particularly people like myself who are further away than Punith and Vibeke from the patient, because I'm a basic scientist. But it really doesn't enrich the science that we do, as long if we keep that sense of perspective. But just to make the point again, that I think it's a multi-leveled approach to research that we need, and not all levels are direct in terms of patient engagement. But if it does filter through those levels, then I think it's to everyone's advantage.
Yeah, but I would say, Chris, it is very important for all members of the public, including patients, to understand what scientists do. So that is seen that this is really something valuable and important and should be done, because otherwise it's always easier for some kinds of politicians to say, we don't need science anymore, we don't need science findings, and we don't want experts.
Yeah, and I think that's true, and it does come back the other way. I agree with you, but I think the UK has a really, really terrific tradition of batting beyond its rankings in terms of world science. I mean, we really are terrific at science, and that science is at all levels. And I think public understanding of science has probably really benefited recently from the COVID crisis, because I think there's a very direct link there between scientists solving a very, very critical problem quickly by coming together. And I think there's been a lot of information flowing back to the public about how scientists work as a direct result of the COVID crisis. So, it's an interesting insight into how the public and scientists see each other, I think.
So everybody, I've got another event which is starting with the IMSR very shortly. So I do need to cut it really short, but I just want to quickly come to the people that haven't had a final thought of the day, just to get reflections from you really on where you see things heading. So we'll try and keep it nice and short if that's okay. But thank you to everybody. Lorraine, should we come to you quickly?
Yeah, sure. So I agree with everything that's been said already, particularly things like the international aspect and the fact that there obviously is a trend to listening to more patients more, which I think is great. I think we're in a very interesting time in history. We're living through an information revolution, which is the implications of which are no less great than the impact of the Industrial Revolution was over 100 years ago. The access that people have to be able to have conversations like this, which we're doing digitally, the opportunities that patients have to connect with each other in the online space, the risks of that, misinformation, people trying to sell things that maybe aren't sort of evidence-based, but also the huge opportunities to become better informed and to have conversations with organizations and individuals that they might not otherwise connect with, I think is really, really interesting. And we're at an early stage of all of that. So I think the opportunities are really exciting. I think I see the use of data, real world data, being something that will develop more. I think as there are opportunities to use devices and things to capture data on what's actually going on in people's lives, as well as things that they might, subjectively report, I think are very interesting. And I just think we'll see a lot more innovation and unexplored angles coming out, and just a more driven by what's actually important to impact on patients' lives. And yes, people have the opportunity to understand more the different stages of the scientific process and different types of research. I think we can all become better educated and we can all do better. So I think it's exciting.
Thank you, Lorraine. And so we'll just hear from Vicky and Joe. I think we've spoken to everybody else. So just a quick wrap up from you two, if that's okay.
Shall I go first? Yeah, research is definitely moving in the direction of having patient engagement, and for all the wonderful reasons that have already been elaborated on. And I think what we're very strong at in the UK, as well as research, is patient groups. And obviously a lot of the patient groups that exist in the UK now have access to an absolutely enormous range of patients, probably more patients within the patient groups than are in any one single centre. So I think, you know, we're obviously the charities are going to be channels and a single point of contact for a researcher to then recruit patient experts from. So I think that's where it's going. It's already happening, and I think it's a fantastic model.
Thank you, Joe. And Vicky.
Well, yeah, basically from my perspective, it was absolutely amazing to actually be part of a research group, and I'm finding it absolutely wonderful that there is this very definite focus on science and research being a lot less of a theoretical thing that people hear about. And I think that one of the things that is really wonderful about, well, one of the few positives to kind of come out of COVID and all of that sort of stuff is the fact that for a lot of people, it's been their first actual piece of education almost into how research and science actually works, almost since the Cold War. It's the first time this level of information has been disseminated. So the fact that there was already this movement to involve patients and involve involve a wider network of people in research, I think that it can only be a good thing in respect of it makes it a lot more transparent and it makes it feel a lot less hierarchical. So I'm really enjoying the way that this is moving forward. It's been brilliant to actually work with groups and make art about it.
Thank you so much, Vicky, and thank you to all our speakers. All your talks have been brilliant, and also to the researchers as well. Thank you so much. So thank you everybody for attending and giving up your Saturday mornings. We do have another event which is about PCOS actually, so if you are interested in finding out a little bit more about that, then I will just pop the link in for that below so that you can join us. But otherwise, thank you everybody. It's been great to see you. Have a great rest of the weekend, and we hope to see you at a future IMSR event.
Thank you.
Bye everybody.
Thank you. Goodbye.